Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Micafungin. Its brand name is Mycamine. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Micafungin. We'll then discuss examples of dosing and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Micafungin acts in a concentration-dependent manner as a non-competitive inhibitor of the formation of the enzyme 1,3-beta-D-glucan, which is a glucose polymer crucial to the structure and integrity of the cell wall of several common fungal pathogens. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of candidemia, as well in the treatment of candidiasis of the esophagus, and this can be with or without HIV. And as well, this medication can be used to treat invasive candidiasis, candidiasis being a yeast infection. With respect to contraindications or reasons we would not be able to prescribe Micafungin, well, we wouldn't give this medication to a patient who had a hypersensitivity to Micafungin or to other echinocandins, or to any other component of the formulation. Now for some examples of dosing with Micafungin. So in the treatment of candidemia, we may see 100 milligrams once daily as an IV infusion over 1 hour. The mean duration of therapy in clinical studies was 15 days with a range of 10 to 47 days. For candidiasis of the esophagus, in the situation without HIV, we may see 150 milligrams per day IV infusion over 1 hour. And the guideline dosage with the time range here would be 150 milligrams per day intravenously for 14 to 21 days. As with all medications, there are some side effects or adverse reactions that patients may experience while using Micafungin, so we'll go over some of those here now. Some of these ranges are quite wide, but keep in mind that it differentiates people using this medication for different reasons. So if you're using it for one reason, it might be a lower percentage. For other reasons, it may be a higher percentage because the dosing would be different. So for acidosis, we may see this happen 20% of the time. Hypokalemia or low potassium may happen 25% of the time. Diarrhea can happen 7 to 77% of the time, so there's one of those wide ranges. Nausea can happen 7 to 71% of the time, and 7 to 66% of patients may experience vomiting. A headache can happen 9 to 44% of the time, and low oxygen saturation may happen 15% of the time. 7 to 61% of patients may develop a fever, and 20% may develop sepsis. Now, two serious side effects with this medication would be atrial fibrillation, happening 3 to 5% of the time, as well as anemia. Hey everybody, that's all we're going to talk about today with Micafungin or Mycamine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.